Is abdominoplasty only for women or can men get it done as well? The answer to it is an absolute yes. Body contouring procedures in general are good for men as well as women. Hi everyone, I am Dr. Dushyanth Kalva and today I am here to talk about a most commonly performed body contouring procedure, that is an abdominoplasty or tummy tuck. So, what is the difference between an abdominoplasty performed in a male and an abdominoplasty done for a female patient? To find that out, first let us know a few things about abdominoplasty. That is, what do we exactly do in an abdominoplasty? Three things are addressed in abdominoplasty. Number one is loose and sagging skin. Number two is fatty deposits. Number three is lax abdominal musculature or loose muscles. So these three things are the ones that are addressed to in an abdominoplasty. Having known this fact, now let us find out the reasons why a man approaches a plastic surgeon for an abdominoplasty and why a woman approaches. There are two distinct reasons for this. Even though the surgery is very much similar, the reasons are quite different. A typical woman needing an abdominoplasty usually comes due to post-childbirth, that is because of 1 or 2 or 3 pregnancies, her abdominal musculature, her skin and everything has sagged along with unnatural fatty deposits. Whereas a man usually approaches a plastic surgeon for abdominoplasty due to a different kind of reasons. That means he has never been pregnant, of course. These men usually are post-weight loss patients. That means they have undergone either rigorous dieting, rigorous exercise, or have done a bariatric surgery due to which they have lost a lot of weight. And then when their body has deflated and their skin is all sagging and their midriff is very saggy and their lower abdominal skin is hanging like an apron over their private parts, and they absolutely do not like it. That is the number one reason why men approach a plastic surgeon for a abdominoplasty. Now let us discuss the actual differences in the procedures performed when done in a man and as to when done in a woman. When we do abdominoplasty in a man, we usually concentrate on getting the skin tone absolutely right. That means we are very aggressive in removing the excess skin, and also we are much more aggressive in removing the excess fat. That means when liposuction, which is usually combined with this kind of procedures, we do a far more aggressive liposuction when we do it in a man. Whereas when abdominoplasty is performed in a woman, usually we concentrate on restoring the lost muscle tone. That means during pregnancy, like I mentioned before, the muscles are usually stretched out and the tone is lost quite a bit. So the main concentration is on restoring the muscle tone, and after that I would do skin excision and also excess fat removal. Also there are a few more minor differences, as in the way I design an umbilicus in a man is slightly different from that of a woman, and the way the incision is put, the skin incision, is actually slightly different when done in a man. Having learned the differences regarding the procedure, there are also certain differences during the recovery phase. Since we do not do muscle repair in a man usually, the recovery is expected to be slightly quicker than that of a woman. Usually when we repair muscles in a woman, we put a lot of restrictions regarding bending, regarding lifting weights, regarding working out, so on and so forth. These kind of restrictions are actually quite less in a man, since we do not do any muscle repair. So the expected recovery is a bit shorter, something in like 3 to 4 weeks in a man compared to that of 4 to 6 weeks in that of a woman. So these are the fundamental differences in abdominoplasty versus in a man versus a woman. If you found this video informative, please like or share or subscribe to my YouTube channel. Thank you.